Hey, Dr. C here. I'm continuing on my series today of things that you can do for yourself to relieve your own pain. We are discussing the 4 or 5 pillars of pain relief. These include detox, hydrate, ambulate, meditate, and caffeinate. Today I'm going to start discussing detox. This is a huge subject, and it's a controversial subject, and it's probably going to rub a lot of people the wrong way. And so I'm going to start out with a few caveats. If what you're doing is working well for you and you're not having any problems with it, then I don't recommend making any changes. Obviously, you're doing fine and you don't need my advice. My assumption is that you're here watching these videos because what you're doing is not helping, or you're not satisfied with your progress or your function at this point. And all I am doing is discussing what I've seen work in patients over the last 20-25 years. In one of my earlier videos, I discussed what seems to be universal among patients that get better. The patients who basically take charge of their own situation and no longer seek medical care for their chronic pain. These are the patients that I wind up seeing out in public, or not at all. They're just lost to follow-up because they no longer need my care. And as I said in this earlier video, the first pillar of pain relief is detox. And detox means getting off of most substances, if not all substances, that you're using to treat your pain, at least ones that you consume and that have a systemic effect. By that I mean, if you take them orally or intravenously or rectally and they cause total body effects, they are probably having long-term negative effects on your body. Why is that? Well, if you understand the way human physiology works, we're one giant homeostatic mechanism. That means we work very hard, our physiology works very hard to maintain normalcy. And anything we do to perturb that system, our body works to undo. So, for example, we are warm-blooded animals. We maintain our body temperature within a very narrow range, and it's necessary for survival. It's necessary for normal cellular function. If our body gets a few degrees too warm, it can kill us. If our body gets a few degrees too cold, it can kill us. And so we don't go outside in the wintertime and suddenly our body temperature drops to the ambient temperature outside. We'd be dead. What we do is we shiver and we develop all kinds of responses to preserve normal temperature. If we can't get inside and the temperature is too cold, or we can't warm up and the temperature is too cold, it will ultimately kill us. And the same thing happens in the opposite direction. If it's hot outside and we're out doing things, our body temperature doesn't rise to the ambient temperature. What it does is it sweats and it works hard to cool itself to maintain a normal temperature right around the range of 37 degrees Celsius or 98.6 degrees Fahrenheit, around that. The same is true with medications that we introduce into our system. Our body wants to preserve normal pain receptor activity. And so if I take an opiate and I interfere with my body's normal ability to experience pain, the body just adapts to that opiate, and it'll adapt rather rapidly. That's why most people, if not all people, who take chronic opiates for pain find that these medications become less effective over time. They work great for a little while, and then they stop working, and then you need more in order to achieve the same effect. This is called the development of tolerance, and tolerance occurs universally. It occurs faster with some drugs than other drugs, and we're talking only about pain drugs right now. I'm not talking about antihypertensives or diabetic medications. I'm talking specifically about analgesics. The body's pain system is very finely tuned, and it wants to preserve normalcy. So when we perturb it, it works to restore normalcy. If you take opiates every day, you're going to develop tolerance. There are some drugs that are delivered intravenously such as remifentanil, where we can see tolerance develop in minutes, meaning that they lose effectiveness within minutes of beginning an infusion, and that's very testable. You can expose somebody to very specific painful stimuli, and then you can test them in the presence of remifentanil, and you'll see that at first they can tolerate more pain, and then rather rapidly that effect drops off and they tolerate the same amount of pain. And if you continue administering the remifentanil, you'll see they actually begin to tolerate less pain. This is a very complex subject, but it's always true. It always happens, and there's no way around it. This is the holy grail of opiates, in fact, is how can we make them work forever? Because right now they simply do not. So if you're taking opiates and you're not happy with your pain control, then maybe you need to consider discontinuing them. It doesn't work well if somebody tells you to discontinue them. This is really something that you have to decide on your own. In later videos, I'm going to go into much more detail on the development of tolerance and hyperalgesia. And so I will answer these questions later on. And I'm sure there are going to be a number of questions about it because, again, this is a touchy subject. I'm not telling you about how I feel about these things. All I'm telling you is what I see. And what I see is that patients who rely on pain medications for pain control tend not to do well over the long run. Another class of medications that you need to try and avoid is alcohol. And alcohol actually is a pain reliever as well. It has some utility in relieving pain. When I was in medical school, an old family doctor who was a professor of ours who used to practice out in the country in small towns where there was limited access to care, would tell patients who were passing kidney stones, well, go out and buy yourself a case of light beer and start drinking it. And his reasoning was, one, it'll relieve your pain because there's no access to pain medications right now, and two, it'll dramatically increase your hydration and then increase your rate of urination and hopefully help you pass that stone. And so, it may even be medicinal. We use ethanol to treat other medical conditions, although less and less frequently in the 21st century, but it still has an application. However, the amount of ethanol that you need to consume in order to get pain relief comes with a number of other negative side effects, and probably in the long run isn't worth it. I mean, you can be, it can impair you, it can leave you hungover, it can kill you if you get a high enough blood alcohol content. And I'm not saying you need to be a teetotaler, but the less alcohol you consume, the better you're going to feel, the better your function is going to be, and in the long run, the less pain you're going to have. Alcohol is another touchy subject, and again, I'm not telling you not to drink alcohol. I'm just telling you what I see. The patients that do the best tend to discontinue ethanol or alcohol as well. The other thing that you need to detox from is tobacco products. And the reason's fairly simple. One, these things contain nicotine, and nicotine is a vasoconstrictor. That means it causes blood vessels to narrow. If you look at capillaries, some of these capillaries are so fine, these are the smallest blood vessels in the human body. These capillaries are so fine that the red blood cells actually have to stack up one by one in order to pass through the capillary. If you're consuming nicotine, you may get enough vasospasm that those capillaries lose blood flow altogether. And why is that important? Well, it's at the capillary level when blood is delivered to tissue. So if you have an injury to a nerve or an injury to a muscle, that muscle can't heal as well or even at all in the presence of nicotine. Nicotine can cause enough vasoconstriction that you don't get healing nutrients and you don't get oxygen delivered at the cellular level. And as a result, the cells just never recover and you don't heal. There are a number of surgeries that go poorly in patients who smoke, and some surgeons won't operate on your spine, for example, if you don't stop smoking first, because it's been shown to interfere with normal healing. And people who smoke may not fuse properly with spinal fusions. I've seen orthopedic surgeons tell their patients they won't operate on them or do joint replacements in the presence of nicotine, and they insist that their patients stop smoking before they'll replace a knee or a hip for the same reason, because the bones don't knit properly and the tissues don't heal. Even anti-inflammatory medications have their limits, and this is something that you have to be very careful with as well. Many of these drugs are available over the counter, drugs like aspirin or ibuprofen or naproxen. Aleve is a trade name, I think. They can all be bought over the counter, and they all have huge potential toxicities. Aspirin and ibuprofen and Aleve can cause kidney injury, and if you take enough of it for long enough, it can result in renal failure. And in fact, earlier in my career, I used to work on a liver transplant team, and at that time, the number one cause of liver failure and need for liver transplant in our program was unintended Tylenol overdose, another over-the-counter medication, and this drug is toxic to the liver. So while these medications may be okay to take intermittently, they all have potential toxic effects. Tylenol damages liver. The others that I discussed, ibuprofen, Aleve, and aspirin, and many others that are available in prescription form, can damage kidneys. And then they can also damage blood vessels, and they can damage the brain, and they can lead to increased risk of bleeding in the intestines. They can lead to increased risk of stroke. They can lead to increased risk of heart attack and congestive heart failure. And the list goes on and on and on and on and on. Most people who take these medications tend to take them to excess. I deal with a population that often receives anti-inflammatories for pain relief, and many of them will come in and tell me how many pills a day they're taking, which is 2 and 3 times the maximum daily recommended dose. It's a recipe for disaster. So while you're reducing your medications, you should consider that even the over-the-counter medications can be dangerous. And it's not just drugs, it can be supplements as well. I mean, many of these supplements, well, all of them are drugs. Anything you put in your body has the potential to have effects that are unintended. I had a friend who used to take milk thistle because he wanted to protect his liver, I think, and he wound up developing problems with liver function. It got so bad that he was getting ready to have a liver biopsy before one of his doctors asked about the supplements he was taking and had him discontinue milk thistle, and that seemed to solve his problem. But even healthy remedies that are intended to be good for you can be dangerous and probably aren't necessary if you do the other things: ambulate, hydrate, and meditate. You'll find that you can do many things that don't require chronic medication use. I hope this video has been helpful. I will go into greater detail in later videos if there's interest. I'd appreciate it if you like the video and subscribe to the channel. And if there are questions, please leave them in the comments. I'll pay attention to the comments. I read the comments. I may not respond to you on an individual basis, but I will take them into consideration when I produce further videos. Thanks for watching.